Did you know that over 80% of people who keep baking soda in their kitchens have no idea they're sitting on a hidden health treasure? It's true. This humble white powder, which costs mere pennies, has quietly earned a reputation among natural health experts as one of the most overlooked remedies of our time. Think about it. How often have you reached for baking soda to clean your fridge or freshen your breath, without realizing it might also relieve arthritis pain, fight off infections, or even support kidney health? In today's video, we'll explore 13 powerful, science-backed ways baking soda can support your body, from your teeth to your toes. Some of these benefits may surprise you, and a few might even change your daily routine for the better. So stick around, especially if you're over 60 and want safe, simple, affordable ways to boost your health at home. And before we dive in, welcome to Healthy Clap, your trusted space for senior health tips and natural remedies. If you're new here, make sure to hit that subscribe button and click the bell so you never miss our weekly uploads. And tell us, where are you watching from today? Drop your country in the comments. We'd love to give you a shout out. Alright, let's get into it. Number 1. Supports gentle detoxification. Baking soda, when mixed with water, forms an alkaline solution. This can help neutralize excess acids in your body and may assist with gentle detoxification. Some people soak in baking soda baths to ease skin irritation and draw out toxins, while others drink small amounts, under guidance, to support their body's natural pH balance. Clinical research has shown benefits particularly for those with chronic kidney disease. According to the Journal of the American Society of Nephrology, sodium bicarbonate helped slow disease progression by reducing acid buildup. This means that your body's detox organs, like the liver and kidneys, get a little extra support. Detox bath with baking soda can also be combined with Epsom salts for improved circulation and joint comfort. Tip: try a 20-minute soak with half a cup of baking soda and warm water once a week to support skin and systemic detox. Number 2. Brightens teeth and improves oral health. Baking soda is one of nature's most affordable dental allies. Its gentle abrasiveness helps remove surface stains from teeth caused by coffee, tea, and aging, revealing a brighter smile. More importantly, it helps fight bad breath and gum inflammation by neutralizing acids in the mouth. These acids promote bacterial growth, leading to plaque buildup, cavities, and gum disease, a major concern for seniors. A study in the Journal of Clinical Dentistry found that brushing with baking soda-containing toothpaste significantly reduced plaque and improved gum health. Try brushing with a paste made from water and baking soda once or twice a week, and follow up with your usual fluoride toothpaste. I'm curious to know, have you tried brushing with baking soda? Let us know in the comments. What did you notice? Comment yes if you have tried it, and comment I will if you will try in future after watching this video. Number 3. Soothes heartburn and acid reflux. Heartburn often increases with age due to changes in digestion. If you experience that burning feeling in your chest or throat after meals, baking soda can be a fast, natural remedy. As an alkaline compound, baking soda neutralizes excess stomach acid, offering relief within minutes. Simply mix 1/2 teaspoon in a glass of water and sip slowly. However, it's not a long-term fix. For chronic reflux, always consult your doctor. And avoid taking baking soda on a full stomach, as it can cause bloating. Science shows it works. A review in gastroenterology and hepatology confirms sodium bicarbonate as a fast-acting antacid. Number 4. Fights fungal infections. Common fungal issues like athlete's foot, ringworm, or even nail fungus can be persistent and uncomfortable. Baking soda alters the skin's pH and inhibits fungal growth. You can make a paste using 3 parts baking soda to 1 part water and apply it directly to affected areas. Leave on for 10 to 15 minutes, then rinse. Alternatively, soak your feet in warm water with a tablespoon of baking soda. A 2014 study published in Mycopathology found that baking soda successfully inhibited the growth of multiple fungal strains. For seniors, who are more prone to fungal overgrowth due to weaker immune defenses, this is a safe, effective, and inexpensive solution. Number 5. Helps ease UTI discomfort. As we age, changes in the body make certain infections more common, and one of the most frequently overlooked among older adults is the urinary tract infection, or UTI. For seniors, and particularly postmenopausal women, UTIs can become a recurring issue. That's because hormonal changes after menopause lead to a decline in estrogen, which in turn alters the balance of good bacteria in the urinary tract. These bacteria, particularly lactobacilli, help maintain an acidic environment that naturally wards off infection. When they decrease, the door opens for harmful bacteria like E. coli to thrive. Now, why is this so important for seniors? Because a UTI isn't just a minor inconvenience. For younger people, it may cause burning during urination and urgency. But for seniors, symptoms can be much broader, or even misleading. Fatigue, confusion, dizziness, or even falls can sometimes be traced back to an underlying infection. Left untreated, UTIs can lead to more serious complications, like kidney infections or bloodstream infections. This is where a simple kitchen ingredient, baking soda, has gained attention as a supportive remedy. Sodium bicarbonate has a naturally alkalizing effect on the body. Since urine is typically acidic, drinking a mild solution of baking soda and water may help reduce this acidity, making urination less painful during an active infection. A study published in the Japanese Journal of Urology observed that women who ingested sodium bicarbonate dissolved in water experienced symptom relief, likely due to a shift in urinary pH toward a less irritating range. Let's be clear though, baking soda is not a cure for a UTI, nor should it replace antibiotics when prescribed. UTIs are bacterial infections, and without proper treatment, they can become serious. But baking soda might play a supportive role in symptom management, especially if used early, under medical supervision, and with careful attention to dosage. A typical home remedy involves mixing 1/2 teaspoon of baking soda in a glass of water, taken once daily for no more than 2 to 3 days. This should only be done with your doctor's approval, particularly if you have high blood pressure, kidney disease, or on a sodium-restricted diet. Since baking soda is high in sodium, it can affect fluid balance and blood pressure if overused. Beyond this simple remedy, supporting urinary tract health in older age also requires a few lifestyle shifts. Hydration is key. Drinking enough plain water, at least 6 to 8 cups a day, helps flush out bacteria before they take hold. Limit sugar and processed foods. Excess sugar feeds harmful bacteria, especially in the urinary tract. Urinate regularly. Holding in urine for too long allows bacteria to multiply. Include more probiotics in your diet, like plain yogurt or fermented foods, which can help replenish healthy bacteria in the urinary and digestive tracts. Avoid irritants like caffeine, alcohol, and spicy foods during an active infection, as they can worsen bladder symptoms. One additional tip: postmenopausal women may benefit from discussing topical estrogen therapy with their doctors. When applied locally, low-dose estrogen can help restore the natural microbial balance in the vaginal and urinary areas, reducing UTI frequency. Finally, be aware of atypical symptoms. If you're a caregiver or family member of an older adult, watch for sudden changes in mood, behavior, or cognition. These may be signs of a UTI even if the person doesn't report any urinary symptoms. Number 6. Heals canker sores. Canker sores may be small, but their impact is anything but minor, especially for older adults. These shallow, painful ulcers often show up inside the mouth, on the tongue, or along the inner cheeks, making everyday tasks like eating, drinking, or even smiling feel uncomfortable. For seniors, the risk of canker sores increases due to factors like dry mouth, medication side effects, and a slower healing response. Common triggers include stress, mouth injuries from dentures or sharp foods, and irritation from acidic or spicy meals. But here's the good news. Baking soda, a simple pantry staple, can help ease the sting and speed up recovery. Thanks to its natural alkalizing and anti-inflammatory properties, baking soda helps neutralize mouth acidity, which is often a key contributor to canker sore irritation. It also helps reduce swelling and creates a more balanced environment that supports the healing process. In fact, the Journal of the American Dental Association has highlighted baking soda as an effective home remedy for reducing oral pain and inflammation associated with mouth ulcers. To use it, mix 1/2 teaspoon of baking soda into a glass of warm water, stir well, and rinse your mouth with this solution twice daily. Swish gently for 20 to 30 seconds, then spit it out. No need to rinse afterward. This method is particularly helpful for seniors because it's gentle, alcohol-free, and doesn't irritate already sensitive tissues like some commercial mouthwashes can. Most canker sores heal within a few days to a week, but if yours lingers or frequently returns, it could signal a deeper issue, such as vitamin B12, iron, or folate deficiency, which are more common in older adults. To prevent future flare-ups, try brushing with a soft-bristled toothbrush, avoid acidic foods when a sore is present, and consider switching to an SLS-free toothpaste, which is gentle on the mouth lining. Managing stress and staying well hydrated also helps. With consistent care and a touch of baking soda, you can reduce pain and get back to enjoying meals and conversations more comfortably. Number 7. Enhances physical performance. Muscle fatigue is a common challenge many seniors face when trying to stay active. That familiar burning feeling during exercise happens because of lactic acid buildup in the muscles, which lowers the muscle's pH and creates an acidic environment. This acidity contributes to tiredness and limits how long you can keep moving comfortably. Baking soda, or sodium bicarbonate, acts as a natural buffer against this acid buildup. By neutralizing excess acid in the muscles, it can help reduce fatigue and allow you to exercise longer and with less discomfort. This benefit is especially valuable for seniors engaging in activities like strength training, walking, or water aerobics, where sustained muscle performance is key. A comprehensive meta-analysis published in the Journal of Strength and Conditioning Research confirmed that baking soda supplementation can improve high-intensity exercise performance and delay the onset of fatigue. This makes it a promising, low-cost option to support seniors aiming to maintain or increase their physical fitness safely. If you're considering trying baking soda before exercise, it's best to start with a small amount. About 1/4 teaspoon mixed into a glass of lemon water, taken roughly 60 minutes before your workout. This timing helps the baking soda enter your bloodstream and do its buffering work during exercise. However, because baking soda is high in sodium, it's important to check with your doctor before starting, especially if you have high blood pressure, kidney problems, or take medications that might interact with sodium levels. Number 8. Supports kidney function. The kidneys are vital organs responsible for filtering waste and toxins from the bloodstream, regulating fluid balance, and maintaining the body's acid-base equilibrium, a delicate balance critical for overall health. As we age, natural declines in kidney function are common, and this process can accelerate in people with chronic conditions like diabetes, high blood pressure, or cardiovascular disease. When the kidneys struggle to maintain the body's pH balance, a condition known as metabolic acidosis can develop, where the blood becomes too acidic. This acid buildup puts additional stress on the kidneys, accelerating their decline and increasing the risk of complications such as bone loss, muscle wasting, and cardiovascular problems. Managing this acidity is especially important for seniors with chronic kidney disease, CKD, a condition affecting millions worldwide and a leading cause of kidney failure. Research has shown promising results for sodium bicarbonate, baking soda, as a supportive therapy to help correct metabolic acidosis and slow kidney disease progression. A well-known clinical trial published in the Journal of the American Society of Nephrology found that patients with CKD who took controlled doses of baking soda daily experienced a significant slowing of kidney function decline compared to those who did not. Moreover, these patients had a lower likelihood of needing dialysis, a treatment that replaces kidney function when it fails. The mechanism behind this benefit lies in baking soda's ability to neutralize excess acid in the blood, reducing the workload on the kidneys. By buffering the acid, baking soda helps maintain a healthier blood pH, which supports better metabolic function and reduces tissue damage caused by acidity. However, it is crucial to approach baking soda supplementation with caution. Because baking soda is high in sodium, excessive or unsupervised use can lead to elevated sodium levels in the blood. For seniors, this poses particular risks such as increased blood pressure, fluid retention, swelling, and even heart strain, complications that can worsen kidney health and overall well-being. Therefore, seniors with kidney disease or any chronic condition should never self-prescribe baking soda. Its use must be carefully monitored by a healthcare provider, who can adjust dosage and assess potential interactions with medications, including diuretics, blood pressure drugs, and others. In addition to medical supervision, lifestyle choices remain essential in supporting kidney health. Maintain adequate hydration to help kidneys flush toxins efficiently. Follow a kidney-friendly diet low in sodium, processed foods, and excess protein. Manage underlying conditions like diabetes and hypertension with appropriate treatment. Avoid overuse of over-the-counter painkillers, which can harm kidney function over time. In summary, while baking soda offers a scientifically supported option to help slow kidney decline in select patients, it is just one part of a comprehensive approach to kidney health, especially important for seniors. Always work closely with your doctor to find the safest, most effective strategy tailored to your individual needs. Number 9. Relieves arthritis symptoms. Arthritis is a common and often debilitating condition that affects millions of seniors worldwide, causing joint pain, stiffness, and reduced mobility. This chronic inflammation can make everyday activities, from walking to simple household tasks, painful and frustrating, impacting quality of life. Interestingly, recent research suggests that baking soda may have a role beyond just neutralizing acids. It could actually help modulate inflammation throughout the body. A 2018 study published in the Journal of Immunology demonstrated that baking soda activates certain anti-inflammatory pathways, helping to calm the overactive immune responses seen in autoimmune conditions like rheumatoid arthritis. These effects were observed in both animal models and human subjects, pointing to baking soda's potential as a natural, systemic modulator of inflammation. While this doesn't mean baking soda is a cure for arthritis, incorporating a small, controlled amount into your daily routine might help reduce joint stiffness and ease pain by supporting your body's natural anti-inflammatory processes. For example, some seniors find that taking a mild baking soda solution in the morning, under medical supervision, can complement their existing arthritis management strategies. As with all supplements or home remedies, it's important to discuss this approach with your healthcare provider, especially if you're on medications or have other health conditions. They can guide you on safe dosages and monitor for any potential side effects. Number 10. Eases cold and flu discomfort. Baking soda is a versatile remedy that can help soothe common respiratory discomfort such as sore throats and nasal congestion, issues that can be especially bothersome for seniors during cold or allergy seasons. One of the simplest ways to find relief is by gargling with a warm mixture of baking soda and water. Doing this twice daily can help reduce throat irritation, neutralize acidity, and lower the number of harmful microbes lingering in the throat, making it easier to swallow and speak comfortably. Beyond soothing the throat, baking soda can also be used as part of a nasal rinse to clear nasal passages and relieve sinus pressure. Mixing a small amount of baking soda with saline creates a gentle solution that helps to break down thick mucus, flush out allergens, and reduce inflammation inside the sinuses. This can be especially beneficial for seniors who struggle with seasonal allergies or chronic sinus issues, helping to improve breathing and reduce discomfort. To try this at home, you can prepare a saline baking soda rinse using sterile or distilled water mixed with a pinch of baking soda and salt. Using a neti pot or nasal spray bottle, gently flush your nasal passages once daily or as recommended by your healthcare provider. As always, it's important to use clean water and maintain good hygiene with nasal rinses to prevent infections. If symptoms persist or worsen, consult your doctor to rule out other respiratory conditions. Number 11. Supports cancer therapies. Emerging research. Emerging research suggests that baking soda may have potential to support cancer treatment by influencing the body's acidity levels. Cancer cells often thrive in acidic environments, which help them grow and spread more aggressively. By increasing the pH, making the environment less acidic, baking soda may help weaken cancer cells, potentially making them more vulnerable to chemotherapy and other treatments. A notable 2009 study published in Cancer Research demonstrated that sodium bicarbonate slowed tumor growth in mice by neutralizing acidity around tumors. This promising result has sparked interest in how baking soda might complement conventional cancer therapies. However, it's important to emphasize that research involving humans is still in the early stages, and much more study is needed to understand safety, effectiveness, and appropriate use. Baking soda is never a substitute for medical treatment. Patients should always follow their oncologist's advice and treatment plan. Still, staying informed about emerging supportive care options, like those involving pH modulation, can help you have informed discussions with your healthcare team about comprehensive cancer care. But listen, while baking soda has many health benefits, it's not right for everyone. If you have high blood pressure, heart disease, kidney issues, or on a sodium-restricted diet, consult your healthcare provider first. Overuse can lead to electrolyte imbalances, especially if taken regularly or in high amounts. Pregnant and breastfeeding women should also be cautious. And if you experience bloating, nausea, or discomfort after taking baking soda, discontinue use and seek advice. Who knew something as simple as baking soda could support your body in so many powerful ways? From brighter smiles to less joint pain, this kitchen staple proves that natural remedies are still full of surprises. Just remember, more isn't always better. Use baking soda in moderation, and always check with your doctor if you have underlying conditions. So now, we want to hear from you. Have you used baking soda for any of these remedies? Or are you trying it for the first time? Leave a comment below and share your story with our Healthy Clap community. And if you found this video helpful, give it a like, share it with a friend, and be sure to subscribe to Healthy Clap for more senior-friendly health content every week. Thanks for watching, and we'll see you in the next one.